Hi, this is Tim Ackesy from Atlanta, Georgia, and I am happy to introduce to you all Andrew Gradone, who is now a fifth-year PhD student here in Atlanta, Georgia. So please tell us what you're studying.
Yeah, well, thanks so much, Tim. That's right. I'm Andrew. I'm a PhD student here studying clinical neuropsychology at Georgia State. So I'm a rising fifth year now. For those who don't know, neuropsychology is kind of a specialty area within clinical psychology. So we have all the skills of a clinical psychologist, but we're experts in brain and behavior relationships and really cognition in general. So that's what I do. I'm also a person who stutters. I've stuttered for just about my whole life since I was 5 years old, and I'm happy to talk about it more with you here today.
Oh, that's great. That's great. And so let's pretend somebody is hurt in a car accident and their head is injured. Prior to the car accident, they were a typical person. And then after their head is injured, maybe you would provide the kind of testing to see if there's brain damage and deficit areas to plan their rehab and going back to work, for example. Is that right?
That's exactly right. So we have all these different neuropsychological tests and batteries where we assess the different domains of functioning. So pre-morbid functioning, intellectual functioning, academic functioning,
Mhm.
memory, spatial abilities, executive functioning. So all these different areas, so we can get a really clear profile of what's going on, where some of the weaknesses are, where the strengths are, and where we can intervene and provide recommendations for treatment planning going forward.
That's great. It's such an important job. I have had a chance to work with some of the people at CHOA here in Atlanta. Um, and people outside of your field and my field might not know that a child who's seriously hurt falls off a horse, they're skateboarding and they hurt their head, that those children need someone like you. And it's also a reminder, wear a helmet. Because
Absolutely.
I personally was skiing one time and cut my scalp open, and I was flat out stupid because I was an adult, and I did it, and I had 100 stitches and 22 staples. And here I am
Oh,
still
wow.
talking, thank God. But anyways, it's very important work, and some people don't know that your field exists. You moved to 2017 to begin your PhD here. Like I said, you just finished year 4, you're in year 5. And I remember when I met you, we met in December of 2020. So I've only known you for about 5 months.
Right.
And I said to you that we have a lot in common, that you reminded me of me because when I was in graduate school, I had to administer standardized tests under supervision. So I'm sitting at Georgia State in the clinic and I'm administering a test, and my supervisor is behind a two-way mirror. The parent of the child is behind the two-way mirror, and
Hmm.
other graduate students were free to watch each other. And I would catch myself sometimes trying to make out shadows. Are there 2, 3, 4, 5? How many people are hearing me? Now, at the time I was dealing with my stuttering, the standardized test, tell us a little bit about the reality if you have significant stuttering as you administer a standardized test, how that impacts the test and the person being tested.
Absolutely. Yeah. So you're right. I think we do have a lot in common. And with these standardized tests, there is a certain way that you have to administer them every time, hence the word standardized. So you have a script that you need to go off of. And that's so important so that we don't skew the results of our assessments. We want to make sure that we are administering these assessments the exact same way to every single patient, client, participant that we see so that our results are as accurate as possible.
Mm-hmm.
And so if there is some sort of feared word or consonant or whatever it is in that script, and you have to read it off, um, that is kind of a scary thing, because you're going to want to avoid that word. But the
Mm-hmm.
thing is, you can't, right? Because you need to say that word, especially if it's for something like a memory test, and one of those words is the word that you have to say, so that when you ask them to recall the word list later, they're saying that exact word. And I have a recent experience that I'd be happy to talk about maybe later with
Yeah.
that. But yes, this is where stuttering can become a bit tricky, for sure.
The digit span subtest,
Hmm.
where I name 5 objects: boot, computer, stereo, car, ladder. And then you are perhaps brain injured. You are supposed to repeat those 5 digits. And it's true, if I stutter significantly as I administer it, you, the client, get distracted by my stuttering.
That's exactly
And
right.
if you're
So
brain injured, it's an extra issue. The other, I know some of the subtests, maybe I will read it, you'll read a paragraph,
that's right.
and the person's supposed to summarize the paragraph.
That's right.
Hmm.
Right. So if I'm reading a paragraph, you want to keep a pretty even tone,
Hmm.
not draw too much attention to any one word.
Yeah.
And if there's a word that you really hang up on, you just
Hmm.
said the word boot. So if you're, getting to the paragraph, the man put on his b- boots,
Hmm.
and that draws a lot of attention to that
Yeah.
word, so
Yeah.
that person might either become hyper fixated on that word, they
Yes.
might not be able to pay attention to the rest of it, and that's interfering with the standardization of the test.
Yes. Yes. I mean, this is raw, this is real, that it's no longer standardized if you have significant stutters. Now, we can talk about it now in May of 2021 in such a straightforward manner
That's
because
right.
now you're equipped to deal with it. When I was doing these tests and being graded, so there's certain forms of employment where there's a high threshold of fluency that has to be achieved by the person who stutters.
Right.
An example, I was helping a young man who was in pilot training in Pensacola with the Naval Academy or the Air Force. It doesn't matter. Flying airplanes. His instructor is behind him. He's sitting in the front cockpit and he's speaking to the tower. So his instructor is scrutinizing his speech. The tower is scrutinizing his speech. And you're actually being barked at for stuttering,
Yeah.
right?
Yeah, of course.
Like in combat, that can't be happening. So he was in incredible pressure and he traveled up to Atlanta to work with me. And it was very, very rewarding. I recently also helped a police officer become a sergeant. And the sergeant examination was an oral examination. There were 160 people applying. He had the highest test score, but he's a person who stutters, and he was about to sit in front of like 6 sergeants that were going to hammer him with questions. So within people who stutter, there's certain criteria, certain career choices where there's a criteria of fluency that has to be met, where it's very difficult to do it. And so I wanted to, kind of frame this, and then we're going to talk about how you've done it. So you told me that you moved to Atlanta 2017 and that you had a lot of stress and anxiety about stuttering. And if I would you share that you were seeing someone for anxiety and then that person, I think, referred you to me. Is that correct?
That's correct. Yeah. So this actually happened a couple months before the pandemic, so it was convenient. So I began my own therapy, not speech therapy, but just traditional psychotherapy in about February of 2020, partially just because of the stress of graduate school.
Mhm.
And also because, as a clinical psych student, I also do therapy of my own, and I thought it would be useful to, see what the other side looks like. But that therapy was wonderful, and we got to a certain point. This was, pretty late into some of our work, maybe about 6 months into it, where I mentioned to my therapist that I feel so unconfident in many of the things that I do in working with patients and talking to supervisors and contributing in group meetings in particular. Just not wanting to speak up because I'm deathly afraid that I'm going to stutter.
Mhm.
And I was telling her, I feel like it's affected my personality. I feel like I am much more of an introvert than I would otherwise be because
Mhm.
I just don't want to speak up in social situations. And that was, I'm really grateful that I did that. I'm grateful that she worked with me on that because,
Mhm.
had I never disclosed that to her, and it took me a long time to
Mhm.
disclose my stutter to her. I'm sure she knew I did, but I never acknowledged it
Mhm.
um, until like 20 something sessions in. And so, in me acknowledging that with her, we could finally talk about it and work on it. And I believe that she had a loved one who actually, and who saw you too.
Mhm.
And so she was able to provide a referral to me, and I emailed you, we had a brief
Yeah.
phone call, and
Mhm.
we made things happen. But I would have never gotten in your door had it not been for me disclosing to my therapist
Yeah.
that I have this stutter and I'm so uncomfortable with it.
Yes. Yeah. Yeah. So you had about 20 appointments with her before you said, here's an underlying thing that, like the elephant in the room type thing. Um,
Yes, yeah.
Here it is. This is maybe my biggest stressor in my graduate program and socially. Um, it is difficult for people who stutter to disclose. There's a bodies of work now on the power of disclosure, saying I'm a person who stutters, developing some humor about it. So we'll talk about that, and also the balance that I can disclose I stutter and be a person who stutters, but I can also execute and really harness and command my speech when I need to.
Absolutely.
So when we met, we found a lot of avoidance tricks. We found eye aversion, eye contact aversion.
Oh, right.
We
Yes.
found, for example, words beginning with the letter R were a fear factor for you. And then I always help people make an inventory. My very first podcast, April of 2020, I was late in the podcast world, but April 2020, my first podcast was purpose, intention, and stuttering. And you and I made a list of all the things you did trying not to stutter. And people have a timeline. And one of your situations was words beginning with R. And those can play out on the standardized tests. So we went
Absolutely.
back, we did timeline therapy. Do you want to talk about that at all?
Yeah, with the timeline therapy, we were going back, and this was kind of transformative to me because I hadn't thought about it this way before.
Mhm.
But there are discrete stuttering events that get stored in our memories. And
Mhm.
so when we start to approach those words again or similar environments again, they kind of get triggered. It
Yes.
comes up. And, that can lead to this pervasive pattern of feared words and
Mhm.
syllables. And, it can be a whole downward spiral.
Yes. I grew up, I spent from maybe second grade through high school on Yellowstone Drive. And I started stuttering on it. I started avoiding it. I would be at the pool down the street from my home, and someone would say, "Oh, you're one of the Mackesy kids. What street do you live on?" And I
Hmm.
would give a street adjacent to the street. And then maybe the person say, "Oh, well, that's a cul-de-sac. So which house are you in? Because I know the Smiths and the Davises." And all of a sudden, I'm in a corner.
course.
because I lied to not stutter. But we can have phobias of specific words. So in CBT, within cognitive behavioral therapy, some of the acronyms are, or some of the styles, if you will, would be mindfulness, solution-focused brief therapy, NLP, which some people don't understand, and timeline therapy comes from NLP. And as you've learned, it's extremely productive because what happens is people have what's similar to post-traumatic stress disorder. If I stutter and I'm teased or bullied, I can attach very strong feelings to those moments. But I can also attach strong feelings to moments of avoidance, where I was in a class and I routinely did not participate. And sometimes avoidance moments are as potent as moments of overt stuttering. But the 3 Ps: punctuate, personalize, and it becomes pervasive. So timeline work goes back on someone's timeline, and we're able to examine moments of stuttering, and you reframe them, you edit them, you delete them, because they accumulate. We don't know what year in your life you began to fear R words,
Right.
but over years and years and years of either blocking on them or avoiding them, that's just an example.
Absolutely. It's a perfect example. And maybe a good time to talk about my experience, because we've been talking about standardized assessments, timeline therapy, ours as a feared word. But Tim, if you remember me giving that one standardized assessment, I needed to say the word Ruby,
Yep.
which, yeah, I said it okay right now.
Yeah, you said
Yay.
it. I remember that
um,
word, man.
yes. And so yes, ours are a big feared word for me.
Hmm.
And on one of the assessments I give, it's a pretty brief assessment, about 15 to 20 minutes. There is a question on it where we're trying to get at people's abstract thinking. And I
Hmm.
say, now tell me how a diamond and a ruby are like.
Hmm.
That's the whole thing.
Yep.
But there's the word ruby. It's a feared word for me. And this was actually quite recent. This was the month of April. So just last month,
Yep.
every Tuesday, I had to give about 5 of these assessments to 5 different
Yep.
people. So I gave it about 20 times.
Hmm.
And the first day I did it, I said it okay the first few times. And then maybe the third or fourth time, I had a big stutter.
Hmm.
It just was not coming out. It was
Yep.
something like, now tell me how a diamond and a it just was not coming out. It was a
Yeah.
total block, and it
Yeah.
took me by surprise. And that became a feared moment, and I was really struggling with that word,
Hmm.
all the successive times that I tried to say it. And
Hmm.
so luckily I was in treatment with you. We were able to talk about it,
Yep.
break it down, use all of your, psychological strategies,
Hmm.
use the motor strategies,
Yep.
and at a certain point I was able to, get it out.
Hmm.
And every time since I've gotten it out has been successful. And that was a really neat example of, the combination of some timeline therapy, CBT skills, using skills like phrasing.
Hmm.
um, I made some phone calls to help practice voluntary stuttering.
That's right.
All the combination of all these skills combined really allowed me to, transform the way that I administered that line from that specific test.
Yeah. So it's critical for me to work with someone like yourself. It's a holistic blend of CBT and SLP. They have to dovetail together. So the CBT component was taking you back into the administration of Ruby to the moment of stuttering and discovering all the unconscious thoughts about stuttering, the beliefs. If I stutter on it, the client patient will think XYZ. And we
Right.
can also be very mad at ourselves. So the two P's are punctuating and personalizing. Both of them were happening. So we reframe the thinking as critical. Otherwise, anxiety before the word will exist indefinitely. Then you said the voluntary stuttering, and then we can do things like get on the telephone and call and use our words. Either the word Ruby by calling Books a Million and finding book titles that have Ruby or authors with Ruby,
Hmm.
and either doing voluntary stuttering on Ruby or attempting to glide into it. Do you have the book Rubies from Africa or whatever? So that's the combo of CBT and SLP. You said phrasing, diamond and a ruby. That's called co-articulation, taking keeping your voice on before ruby because R is a voice sound. So yeah, we hit it from every angle, desensitize it, reframe it, get rid of the stigma on R, and then give them motor help, diamond and a ruby. And now you're solid on it, right?
Solid. And honestly, it was a mind-blowing experience. I was like, I would not have been able to get over it without your help. And I think I sent you an email
Oh,
after
thank you.
I
Yeah,
got
you
it right
did.
the first time. I'm like, I actually
I
did
know. You're
it.
like all
I
day.
can't believe it. I
Every
can't
time I
believe
gave
it.
it.
Yeah. So
Yeah.
neat.
And I mean, I'm so glad the person referred you to me, and these victories, the police officer who's a sergeant, the person who's a pilot, the nurse who is doing better and better at the bedside, just all these victories are so fun to share. Um, so I tell people that disclosure is the toll booth to evolution, to evolve. How would you, because you finally disclosed to your counselor who referred to me, and we also talked about your ability to disclose in an interview for placement. So tell everybody, if you agree with me, disclosure is like a toll booth. You pay the toll, then you can evolve.
I completely agree with that. I think it goes back to your first podcast, Purpose and Intention, which is an excellent one. And if I have this deep fear, I guess if my intention when I'm speaking to a person is, Andrew, don't stutter, don't stutter, don't stutter. That's all I can focus on. And the purpose that it should be just to communicate my message. And so by disclosing up front, I can I can flip things around so that
Mhm.
it's on the table. They know that I stutter, so I don't need to be fearing that they're going to
Yep.
find out. They know
Yep.
it's not a big deal, and I can communicate. So yes, we we talked about disclosure, and I had an interview during the time that I was seeing you for a practicum position
Mhm.
for my program, and I tried out what it would be like to disclose to the
Mhm.
people who were interviewing me and
Mhm.
just say something like, by the way, I have a stutter. Let me know if you need me to repeat anything or miss anything. So I was not
Perfect.
apologetic at all. So,
I was about to say, not apologetic. That's the
you
key.
know,
Hey, just want you to know there are times when I stutter. If there's a word you didn't understand, I'll be happy to say it again. Next.
exactly. Yeah. So for
Not quite
folks,
that flippant, but
right,
we
right.
got the gist. Never apologize. Just say sometimes I stutter. And beautiful, man. So you've learned about projecting, personalizing, discounting the positive, black and white thinking, all the top 10 forms of twisted thinking,
Yes.
without describing what the no pattern is, what the yes pattern is, what the swish pattern is, what the meta alignment pattern. Those come from neurosemantics and from NLP. And you've benefited from all of them. It's the stuff that I did on myself after going through trainings and stuff um, children who stutter and adults who stutter, I do it 5 days a week. The cinema of the mind, what is that?
So this is just how your mind can kind of go on and create its own stories without even trying. So, envisioning yourself, and correct me if I'm wrong, but, envisioning all the different ways that, something could go wrong,
Mm-hmm.
um, before you've even done it. And, I think you can get into some dangerous territory there.
Mm-hmm.
And, using some of those CBT techniques, asking yourself, what would it mean if I stutter? You can kind of keep that in check, um, so that these stories, movies aren't playing out
Right.
on their own, that are going to negatively affect your ability to
Yeah.
communicate your message.
An example of the cinema of the mind is when you were in virtual, everything was virtual with your program, and we all know why. You could potentially be in a what we'll call a Zoom room with multiple people,
Hmm.
and you have what some people might call an authority figure, somebody who is above you in the program, faculty member, a college professor, a dean, and the cinema of the mind can come in how?
Well, um, it could definitely come in this way. So I might picture myself wanting to contribute in some way. I might know the perfect thing to say,
Mhm.
but then the cinema starts playing, and it goes something like this. Andrew, if you speak up and stutter, that authority figure is going to hear it.
Mhm.
They're going to think you're incompetent.
Mhm.
They're going to think you're super anxious, don't know what you're talking about. You're going to look stupid. You're going to look inferior
Yeah.
to your classmates and peers.
Mhm.
And you see how, one thing
Yes.
leads to,
Yeah.
to the next.
And you can have your own criteria. For example, if you had a 1 to 10 scale, that person is like a 10, I don't want that person to hear me stutter. Some
Right.
of my fellow PhD students, I might call them my associates.
Hmm.
I may have a rating on them. Let's see, David would just be maybe a 2. He's really cool. I had a beer with him a few months back.
Right. Right.
Um, then there's this guy named Charlie who is super verbal. He's really he's got really funny lines and he's really outgoing. And so I'm comparing myself to him. So if you stutter, you understand the cinema of the mind. Or if you go up to Starbucks, you can be wondering what the cashier will think versus the barista versus the people standing behind you. You can think that, well, they seem to all be in a hurry, so I need to go ahead and rush what I'm saying. That's the cinema of the mind. So for people who stutter to get really, really solid, they have to understand that they can project their thoughts in different directions. Or you're driving and somebody in the back seat goes, I'm really hungry, pulled into Chick-fil-A. You're like, oh, great. Now I get to order for everybody. And as you're
Right.
pulling up, you can have a criteria. The person in the passenger seat, you already know that person. And they've probably heard you stutter. But there's a couple people in the back seat who haven't. These are these psychological things to understand with stuttering that we can begin to project different thoughts on different people in a millisecond. There are people who stutter that say their phone rings, they look down, and if they see a particular person's name, they get a trigger in their soma, their chest or stomach, like, oh my gosh, don't stutter with him. So these are a lot of the things that we've worked on together. And because you put these puzzle pieces together and you're working so hard and you've been trial by fire, having to administer these tests, you're really putting this stuff together. Um, Butterflies versus anxiety. Do you want to share what that is?
Yeah. So I think both of them are forms of anxiety but butterflies are, it's like it's like that arousal scale. I forget what it's called, but ideally, if you're too aroused, it's going to negatively affect your performance. So too anxious, it's more likely you're going to trip over your words more. But if you just have some butterflies, that's more of like an exciting feeling.
Mm-hmm.
And by reframing the anxiety surrounding speech and stuttering as butterflies, it can really help you to be more comfortable, confident, a bit even excited about
Mm-hmm.
what's about to happen. So
Mm-hmm.
I definitely did that. Going back to the Ruby story, you know, when I was approaching that phrase, now tell me how a diamond and a ruby are like, I would
Mm-hmm.
still get that, feeling in my soma each time, but I would kind of start welcoming it and viewing that feeling as like this butterfly feeling. And that really helped me. And you know what? I also viewed it as an opportunity. That's a big thing. That's a big change I've
I love
made.
it.
Viewing every opportunity or every chance to talk as an opportunity
Yep.
to practice my speech. And
That's the
instead of, yeah,
mindset. We've talked about playing chess with stuttering.
right, right, right.
There's a famous quote, the journey begins within and it ends within. Stuttering is not external to us. People
No,
can't make me stutter.
no, no.
So, yeah, I love the word welcome. See, if I, let's go back 4 months ago.
Okay.
If you had to call somebody really important in your program and his name began with an R, Reginald,
Yeah.
true that. I mean, that could have been, you might have freaked out.
Oh, of
And
course.
uh, anticipatory anxiety, also known as state anxiety, we know that stuttering is a social anxiety. Anxiety is felt in the soma anywhere between the stomach up to the larynx, and it can be on a 1 to 10 scale. I teach people how to rate it. Is that right? Just like you.
Yep, yep. That's right.
Butterflies would be like a 1, 2-ish. It's showtime. If I'm invited to go speak in front of a group, when they introduce me in front of the audience, I'm about to speak for 2 hours, 3 hours, however long, in front of a group of 150, 200, 250. I have some butterflies. I'm excited, ready to talk. So we have to discern the difference between butterflies and anxiety. We hope to get to the point where it's just butterflies. Right now, you are enjoying being able to say Ruby.
Oh, I am.
I
Oh, I am.
still enjoy being able to say my last name. I silently blocked on the telephone for a decade. I got hung up on for a decade. So just being able to answer the phone and say my last name or making an outbound phone call and introduce myself, I'm still happy because it was that hard. So welcoming the feeling as it's just a feeling. This is irrational for me to be terrified of a stutter right now. You welcome the feeling. The opposite, fight or flight, panic. So that's massive.
It is. It is.
I can do this. I can handle this. We've worked in the mirror. You've made phone calls in the mirror. I taught you how to dig a well before you're thirsty. What's an example of when I used to say, Andrew, hold off. Let's do a couple things here before we actually dial.
Yes. Yes. So we had some particular phrases and words that we wanted to practice on the phone,
Mhm.
usually our words. And
Yeah.
I remember one of those phrases. Let's see how I do it now. It was, I have a 2015 Jeep Wrangler 6-cylinder. How much for an oil change? There we go. So
Yay, ding, ding, ding. That was hard, bro. I remember
that
that.
was hard, but not because of the R, actually. It was actually the 6-cylinder piece that was so difficult. I actually
Mm-hmm.
made that call a couple times yesterday just to see, and
Good for
I
you.
was successful there. But
Mm-hmm.
but what we were noticing was I would get so, I mean, like 10,
Yeah.
like a 10 out of 10
Yeah.
anxious. I mean, everything would just tighten up. and the words would just not come out.
Yep.
And so you described making a phone call in a situation like that as stepping out in front of a bus. Like you're not
Right.
going to be successful if you make a phone call when you're
In the
that
middle of
anxious.
panic.
Exactly, in the middle of a panic episode. Not a
Right.
not a panic attack, but a panic episode, right?
Afraid to stutter. Yeah.
Yes,
It's one
exactly.
thing if there are flames leaping in your kitchen and you're dialing 911,
Right.
there's not time for a speech strategy.
No.
Run and make the call, right? But what we're talking about is your objective was to, for example, have R solid as a rock. And interesting, Ruby came later.
Yes, it did.
So Jeep Wrangler, there's also the tendency to end up changing the script at the last minute. We think we're going to stutter. So let's pretend we agree on, I have a 2015 Jeep Wrangler 6-cylinder. How much for an oil change? It's all phrased.
Hmm.
And then the person answers and we say, yeah, I was wondering. So we just got off our script. And
Right.
if we're attempting to hit the ball out of the park, we want to stop and quality control, figure out, and then commit. I call it commit. Commit to what you're going to say. And then we'll work out the rest. And you discovered that eye contact in the mirror was critical. Do you agree?
Definitely. I don't think I was aware of how often I was averting my gaze,
Yeah.
and you helped me become conscious of that.
Mm-hmm.
But eye contact has become so critical
Yes.
for me.
Yes. If I feel a stutter coming and I look away from you, I become dissociated.
That's right.
Mind and body are severed, meaning my body's here, but I'm wondering what you're thinking. Are you making facial expressions during my stutter? That was massive. Some people sit in front of a mirror, and if they feel a stutter, they look away from themselves, which
Oh yeah.
indicates some shame, some embarrassment about stuttering. That's why the eye contact's important.
Yeah.
This brings me back. One other story, brief story of high criteria. Several years ago, the number one quarterback in the state of Georgia, a 5-star recruit in both football and baseball, stuttered. He was, as a junior, able to start at quarterback, which you don't always get to do that. Or not all. Trevor Lawrence, who was a starting quarterback as a freshman in high school, story goes.
Wow.
Anyways, this is what was happening with this young man. He had been offered scholarships to every school you could name in both baseball and football. And it was summer, the season was about to begin, and he stutters. And he would get out there in the huddle and remember, someone's timing you. Someone's timing you. And they have their playbook, and he's blocking, he's putting us in. And some of the seniors were like, man, spread it out. We can't have this. So then the coach was having the tight end or receivers trying to run the play in, and then they're messing up the play or the tempo of the play. And it was a hot mess. I was thrilled that this young man was able to travel across the state and to come in here. I had his playbook. First of all, we had to go into his head. What do you think we had to find, Andrew?
Well, you define those that narrative, those that core belief. What does stuttering like? What does it mean to him if
Yeah,
he stutters? Right.
that's right. If when I stutter, this is what the coach thinks, the
Hmm.
seniors, the people, I'm messing up, for the whole team. I might lose my starting job because of stuttering, da da da. So we had to get in there and reframe the thinking. And I remember having his playbook and phrasing the plays. I'm just going to make up a play like
Sure.
Wildcat, Blue Cowboy on 4. So we would phrase and use voicing. And it was again, it's just a very high criteria story. Um, where you have to combine CBT and SLP, and you're under the clock of a referee in the game.
Right,
That's
right.
fun. That
It
is fun.
is, yeah.
The young man picked baseball full scholarship. That's a great story.
That's excellent.
Not because of stuttering. He just liked baseball more. Okay. So do you feel equipped? You have a brand new colleague or a client whose name begins with an R. Do you feel equipped if you sense that there's a phobia of a particular word or sound or situation is attempting to grow roots? Do you feel equipped to handle it?
Oh, absolutely. Absolutely. And, this is where, I would honestly view it as an opportunity, as a challenge.
Love it.
Um, and if there's one word that I could use to describe how I feel after, 5, 6 months of speech with you, it would be empowered. Um, that there, it's not like I don't ever stutter anymore. I still do,
Mm-hmm.
but um, like you say, much of the time we work to remove much of that malware, and I do feel like a lot of that
Yes.
malware has been removed,
Mm-hmm.
and I feel like I have so many new tools and skills
Mm-hmm.
that I can use both as I'm actually speaking
Yep.
and both after and before stuttering events. So,
Mm-hmm.
say I have that new colleague, his name is Reginald,
Yep.
and I butcher his name. That's a stuttering event, which could become pervasive, and I could, mess up his name
Mm-hmm.
every time I say it.
Mm-hmm.
Um, but, with the combination of the CBT skills,
Yep.
and SLP work, I feel equipped to deal with that sort of issue.
I think you are too. And the fact that here you are doing a podcast 5 months after I met you is profound. And I do my best to give people a toolbox of speech pathology, best practices in speech pathology, and teaching people how to do some CBT strategies on themselves. So I think when the pandemic, when let's pretend you're able to go to a conference, a neuropsychology conference in the fall,
Mhm.
let's hope, okay?
Sure.
That you would be able to go somewhere, fly to Orlando or something, and be in a conference hotel and have breakouts. And maybe the first morning the person says, hey, let's go around the room and say our name and 3 things about us. That you'd be equipped to do that. And that the breakout groups, the social, the little chit chat in the hallway, to going out for dinner with colleagues, all the way to being able to present one day, that you're able to run a movie, I call it. As I think about doing that, do I have anxiety in my body? Yeah. What is it? It's like a 5 out of 10. And then you start asking your questions. What do I believe about stuttering? What would it mean to be in a stutter? The meta model questions, they're called. Bandler and Grinder from NLP. The meta model questions are money. It's all day questions. What do I believe? What would it mean? That's the projecting. What do I believe about stuttering will take you to projecting. What would it mean to me takes you to personalization. And you've learned, I've cautioned you as you're getting better, projecting dies first usually. People are like, I never knew what people thought. And I still don't. In my case, I was teased a number of times through childhood, through college, and even in early careers, um, mimicked, laughed at. Um, the risk there is we generalize. Let's pretend there's 5 times someone's been, mocked or laughed at. They generalize that everyone thinks that way. And then they
Right.
go into the trying not to stutter mode. They're in their purpose and intention. But anyways, the ability to assess and see, what am I thinking, and then change the thoughts and then formulate a plan for speech if you had to present in front of an audience with PowerPoints. But I mean, I admire the work you're doing. I admire the field you're entering, because we all have loved ones who maybe have a stroke, a traumatic accident, seizure activity. Some people have multiple seizures, and then unfortunately they have challenges with memory and speech. And you're going to have a unique, I think, niche for when there's a cognitive impairment and a speech impediment. Do you?
Oh, I definitely agree. I agree. I think it'll give me, um, a little bit of a different perspective because I can empathize a bit there.
Yes, you can.
And so, I understand what it's like to, know what you want to say and
Hmm.
just be unable to come up with those words.
Yep.
And I think empathy is so important in these
Hmm.
helping professions. You are in a helping profession,
Yep.
I'm as well. And,
Hmm.
our patients are humans
Yep.
with people who love them and deeply care about them. I
Yep.
care about all of my patients, and I think this diverse aspect of my identity allows me to you know better empathize
Yeah.
with folks.
You were telling me that someone you were testing, a client or patient, do you call them patients or clients?
Actually, it depends
Okay.
on where I
Okay, cool.
see them.
But didn't they stop you and say, you speak so clearly and so well? Do you remember that story?
Yes, honestly, that was a mind-blowing experience for me. It was, I mean, the epitome of a corrective experience,
Hmm.
since so much of the time, uh, at least myself, and I think other people who stutter are,
Hmm.
projecting their thoughts onto others. They're thinking, oh, that person, thinks I stumble
Right.
all over my words.
Yeah.
But I was leading a group
Hmm.
with um, older adults with MCI and their loved ones, and kind of teaching them how to use this memory support journal as
Yep.
an external representation of their
Yep.
memories. So
Yep.
putting everything down in there. So I was leading this group, and before we started a session, one of the care partners stopped me and said, Andrew, I just want to say, you speak so clearly and you articulate so well. It makes it really easy for me to hear you.
Mm.
And you should serve as an example for all the other clinicians in this program.
Yeah.
And I was like, what? Really? Well, I mean,
You were integrating the phrasing like Morgan Freeman.
I was. I
Mm.
was. And it just came out of left field because I had
Yeah.
not even disclosed to them that I had a stutter.
Hmm.
So it's not, I don't think she was trying to, make me feel better
Right.
about my speech issue. It
Right.
just came out of the
Hmm.
blue. Um, and, on Zoom platforms, I think sometimes it can be more difficult to
Yeah.
hear folks. So I, try my best,
Mm.
especially when I'm working with them, to really
Yeah.
articulate. But this actually relates to one point I wanted to make,
Mm.
which is turning a weakness into a strength.
Beautiful.
And, because I have this speech issue, it's kind of forced me to really focus on my speech and
Mm.
becoming, more clear when I talk,
Yep.
using less fillers, articulating well. And
Hmm.
I think, my speech is slowly becoming more of a strength
Yep.
rather than a weakness. And that is just such a
That's
cool
profound.
thing. It is. It is.
That's a
It's profound.
complete 180, uh, holistic reframe. The meaning of stuttering has completely changed. I was going to ask you, so it took until you were about 25 years old to tell people, I stutter.
Yes.
What advice do you have for kids K to 12 about just go ahead and say you stutter.
Yeah, well, it's easier said than done, but I really believe, if you are in a place and you want to make that change,
Mhm.
if you want to start more explicitly working on your speech,
Yeah.
it can really it can really turn things around by
Yep.
just disclosing so that you don't have to live in fear at all times. This person is going to discover that
Yep.
I stutter. Um, so, I would recommend disclosing in the most comfortable settings
Yep.
first. So if you have a best friend that you've never told, tell them. If you have a
Mhm.
teacher that you really admire and they're extremely understanding, tell
Yeah.
them first. See how it goes
Yeah.
in safe settings first.
Yes.
And if you're ready to do so, try disclosing to some bigger groups of folks. It's
Yeah.
never going to be easy. And sometimes you'll expect a big reaction like, oh my gosh, I had no clue, or that's so brave of you,
Yeah.
or
Yeah.
oftentimes like it could just be anticlimactic, like, oh, we knew, it's not a big deal though.
Yeah.
um
A lot of times, children are sitting in the classroom. They've never told their teacher they stutter. Now, the teacher may have picked up on it, may not have.
of course, yeah,
Sometimes the parents have not advocated for the child. So the child's sitting in there with the purpose and intention of trying to conceal their stutter, and they're back there not raising their hand. They're not participating, and they feel anxiety in the school building basically all day long. If that child emails the teacher at the beginning of the year and said, I just want you to know I have a stutter, man, that way they can form some accommodations. We don't want the teacher to enable the child by
right,
excusing them.
right,
We want to help the teacher empower the child to stand with his peers and communicate and to not allow teasing and bullying. We also encourage parents go on my website. I have a page, how to educate teachers. The school year is coming to an end, but next August, make sure caretaker parent meet with the teachers, advocate, because that's another way to allow children to disclose, is that the parents told the teacher pulls Tim aside and says, I understand you stutter, that's fine. You're welcome in my room. Let me know if there's any way I can help you. Whew, man,
that could make a world of a
what a
difference
relief.
for a kid who
What a
stutters.
relief.
It could,
Yeah.
yeah.
I everyone knew I stuttered, and I was a like split personality, thinking, well, people don't know, but they do know. And the energy lost in trying to live two lives, if you will, be two people, a person who stutters, a person who doesn't stutter. Um, I wasn't fooling myself, and that's the most important thing, right?
Right.
But have you seen the movie When I Stutter?
Yes, you recommended it to me very early on. It was one of uh, the first things I ever watched related to stuttering. At least I think it's, yeah, and it
Isn't
was
that
it was it was
fantastic?
powerful. I mean, I was in tears for
Yeah,
a good part of it. It was just so
that's right.
powerful.
Yeah. So uh, look up whenistutter.org. Fantastic movie. And 19 adults who stutter are interviewed and tell their life story. And it helps us to reframe. Anyone out there, if you're ready to get into a support group for adults who stutter, either virtually or in person as that starts happening again, that can be a way to meet other people who stutter, find out you're not alone, as well as get some metaphors. Like the person who's across from you is a nurse who stutters. You're like, wow, you're a nurse who stutters, or an attorney, or a college student. It's like, wow, you have faced this, I have faced this, and you develop friendships. Um, awesome, awesome, awesome. Anything you want to add here at the end?
You know, I guess I just want to add that in terms of advice, if you want to change, you can. It's never too late to start, no
Mm-hmm.
matter how old you are. I personally, I always viewed my stutter as a pretty mild one.
Mm-hmm.
Um, I'm not sure objectively how it came across, but at least I personally viewed it as more of a mild one. And that's part of the reason why I didn't disclose it that often. And I waited until I was 25 to explicitly work on it. And I kind of thought it was always going to go away on its own.
Mm-hmm.
It didn't. It always stayed
Yeah.
just about the same.
Yeah.
So, you know, maybe you aren't ready right now.
Mm-hmm.
That's okay. No one's forcing you to get started. Um, but if you are ready, you can make those changes. There are lots of resources out there. This podcast is a really good place to start. I mean, there's so many incredible resources here. I've listened to many of
Oh,
these
thank you.
episodes, and it's really, transformed how I viewed stuttering in general.
Mm-hmm.
So, um, yeah, there's you can change if you want to.
I love it. I love it. I had a 73-year-old client in 2020 who was uh, frustrated being unable to say his first name. Still, and that was the metaphorical, that was the leverage bar, right? That brought him in. But Sabu, who is an earlier podcast, came to me at age 52. Listened to Michael Coates, is late 40s, almost 50-ish. His podcast was just recent. Josh DeMuth's podcast is the one before this. He's in his mid 30s. So yeah, not too old. A lot of this stuff, the thinking patterns, are like those old VHS tapes that just replay to the end and then spin, and they rewind themselves. The same negative thinking patterns that might have started at age 17 are still going at age 55. But when you cut the VHS tape, it can't be played anymore.
Exactly.
And the ability to use CBT to go back and do timeline therapy and do deep core restructuring of thoughts in a hurry, like a matter of months, um, is really fun. It's a load of fun. I always tell people that it took me a lot longer to help myself than it takes for me to help somebody else, just because I consolidated, got certified, studied, spent money, traveled to classes to put together a toolbox, the one that's in the garage that stands on wheels, try to put together different things. So you're doing a fantastic job in just 5 months. And again, I want to applaud the your choice to devote your life to helping people in need, that you're doing a PhD program. You've already done 4 years and you have more internships and clinicals, that you're dedicating so much energy to help other people. I think that's really cool.
Well, thank you, Tim. I love this profession that I've
Yep.
chosen. It's a long road. It's a difficult one, but I'm passionate about
Yep.
helping out these folks, and I know you are too. So thank you
Yeah.
for helping me come so far
Yeah.
with my speech. It's really been
Yeah.
an incredible experience working together.
It's been an absolute pleasure. So I'll talk with you soon. All right.
That sounds great, Tim. Thanks so much for having me on. It's been great. It's been great.
Thank you, Andrew.
Take care.